Okay, well, this morning we've been here to meet with the Royal College of Nurses. Clearly a very challenging situation facing our whole health service, but in particular our nursing staff who are on the front line. And I mean, it's very clear from speaking directly to nursing staff this morning, the fact that they feel undervalued, the fact that they feel exhausted, they're demoralised, and they're crying out for support and for help just to do their jobs. I mean, and these are people who are on the front line every day, working and caring for our loved ones, any of us at any moment in time, but yet and all they're not working in a condition that's safe. They need safe staff and legislation. We need very clear plans to how we're going to recruit and retain our nursing staff. Like it's the very basics in life, I think, to be able to go to work and feel safe in your place of work. What we need now is an executive. What we need is an executive that prioritises health. What we need is an executive that actually works very quickly to fix what's wrong so that patients can get the care that they need and that our staff can go to work feeling safe to provide that very necessary care. I'm not giving up, because I think the one thing that nurses also ask for is some hope. Some hope that there will be an executive, some hope that we can work with other parties, some hope that we can prioritise a budget for health, some hope that we can put proper strategies in place that actually allow us to make sure that we recruit the sufficient numbers of staff into the health service. So I'm not giving up. What we now need to see is the protocol discussions to continue in earnest. What we now need is a speedy resolution, an agreed resolution that allows the executive to go back up. That's what I'm working for. That's what the nursing staff are telling us that they want us to work for, and I think the public deserve no less. I mean, I think you can't divorce the fact that from the Tories come into power, we've had 12 years of austerity, 12 years of cuts, 12 years of stripping out our health service, and I think the pandemic really highlighted that. So we've got a health service now that has so many staff vacancies, 2,500 vacancies in terms of nursing staff. I mean, that's a health service on its knees. And what we now need to see is investment in that health service, which is why Conor Murphy, as the Finance Minister, actually set out a plan to agree a budget that would have prioritised health, that would allow us to invest in our staff, because the biggest asset that the health service has is its staff. It would allow us to invest in cancer strategies, in our waiting lists, all these things that are a priority if we're going to help our health service to get through this period. I think the situations that we've seen in our hospitals in recent days are just not tolerable by any stretch of the imagination, both in terms of the patient experience but also the staff and experience, because these are people who go there every day against the worst challenging times and actually try to do their best for people.